Okay, and we are live. Welcome to episode 9 of Shifty Perspective. Today, we will be speaking to Dr. Valerio Di Nicola, who is a surgeon and scientist. We are about to discuss with him his work in regenerative surgery and life extension, as well as longevity in general and the current situation of COVID-19 and how that affects this field. Feel free, if you're watching the live stream, to leave any questions in the live Facebook questions box, in the comments box. And anyone after this, if you have any questions, feel free to leave them in the YouTube description. Hello, Val, how are you doing?
I am fine. Thank you, Ash. And good afternoon to everybody that are connected.
Good afternoon to you and good afternoon to everybody else. Yeah, indeed. So whereabouts are you at the moment? You're in the UK, I believe?
Yeah, I live and work in UK. So yes, to say something about me, I am a consultant surgeon in working in the NHS.
Yep.
West Sussex Hospitals Foundation Trust. And I work there as a general and lower GI surgeon. We can say this is my surgical traditional part of my job, but alongside that, because everything started my research when I studied during my PhD and post-PhD, that was in microsurgery and regenerative medicine.
Okay.
So this was more or less across the millennium, and it was extremely interesting because many things were going out at the moment, mostly in the regenerative surgery and medicine, in terms of tissue regeneration, stem cells, usage in experimental models, and the tissue engineering, growth factors, mediators, and so on. And these brought to me to different kind of experimental and clinical experiences, mostly applied in some kind of sector of surgery.
Okay.
And in particular in joint regeneration and hernia repair.
Okay.
Of course, yeah, Ash, the last thing, then I leave you words. When we talk about regenerative surgery, it means simply that sector of regenerative medicine that can be applied with surgical procedure.
Okay, that was literally going to be my next question, was asking about what exactly is regenerative surgery. For the research with stem cells, is that something that is currently available, that you are involved with in the UK? Are there a lot of treatments with stem cells as an option right now?
Well, yes, there are options, but still there are not, I can say, NHS validated options.
Okay.
And this is not only a problem in UK, it's a problem everywhere in Europe, in the United States, and it generates a lot of side effects. However, in particular, my field of expertise is the stimulation and activation of residential stem cells.
So is that taking already?
Well, that means it's very simple. Any tissue, in particular, soft tissue, mesenchymal tissue, connective tissues, has a cluster of mesenchymal stem cells that work in a certain manner in that tissue. And my research was simply to stimulate the residential stem cells of tissue to generate tissue repair without transplantation of cells from a tissue to another.
So what kind of level of injury would this be applicable to at the moment?
Well, consider, for example, degenerative osteoarthritis is the most common single cause of disabilities in our days.
Yep.
And degenerative osteoarthritis in reality for many years is a reversible disease.
Really?
Yeah, it's a reversible disease because it's a very long process. And generally it takes years to develop.
So what happens with it? How does it work for anyone?
It's happened that all joint tissue are involved in a kind of inflammation and degeneration process involving the capsula bursa tissue, the cartilage, and the bone, of course, in a proper timing.
Yeah.
So at the beginning, when what we call the early osteoarthritis, there are marks of inflammation with some kind of pain, but no radiologic evidence of the disease. Only with magnetic resonance and some kind of ultrasound, you can detect some very tiny signs of the disease. At that point, if you intervene with some kind of treatment that can reverse the process, you can curb it and stop it to progress.
And what age does this normally start affecting people?
Oh yeah, this is very variable. To say, or as an example, even in a young guy, 20 years old, 25 years old, you can have a minimal sign of osteoarthritis, mostly if it is involved in sports that easily injured the back, the hip, the knee, such as rugby players and American football players, and football players as well, mostly the knee and the ankles. So all depending what is your activity and what is your genetic asset, what is your BMI, that is extremely important. And all these kind of things and others, of course, affect the age when this disease starts.
So when it starts happening, how many symptoms are there? If you're fairly fit, okay, for example, I do martial arts, so there are, I get thrown to the ground, definitely have some, impacts on my hips. If I have that regularly over a period of a few years, how would I start noticing that this is actually occurring, that I've got beginnings of osteoarthritis?
Well, repetitive injury are quite tricky because generally you develop the disease with no awareness. But a small pain that generally recurred and sometimes become a little bit more boring in your daily activity. You take some kind of anti-inflammatories, you feel better, and you carry on.
Okay.
And this happened for months and then years. And this is what's generally happen in the degeneration. The pain is the main symptoms. Then then later the reduction of mobility and this can affect your quality of life in long term.
Okay, and then when that actually starts happening, at what point does it become irreversible? So
well, the point of to be irreversible is at the moment there is no consensus about that.
Okay,
it's very controversial. However, what we know, of course, that we of course do not move immediately with some kind of what we can call even a minimally invasive procedure. The first thing is to change that kind of habits that generate that problem. So if you have a knee pain because your BMI is quite high, the reduction of BMI and some kind of a healthy sport activities help a lot
Yeah.
to curb the situation. The use of a short-term use, 5-7 days of anti-inflammatory can help, of course, for the rehabilitation. Physio treatment are quite important in this stage, mostly in the water.
Okay.
Because in water you do not have the gravity force, and so moving in there, not only swimming but simply running or doing any kind of activity can improve the mobility in a smooth way.
I've seen the underwater treadmills actually, and yeah, I've heard that, especially for people with who are very overweight but needing to lose weight, but they can't start running because of the extra pressure on their joints. That's a good way to start. And with your work, how would at what point would somebody come to you? So they've been running, they've been having increasing their diet, reducing their BMI. Would you say having stem cell treatment is a last resort, or is that something that is positive, even not as an extreme measure?
Well, consider the current situation that generally we have in treatment pathway. No, at the beginning there is the use of painkillers, physio treatments, in local injection, unfortunately corticosteroid, some hyaluronic acids. Then generally the orthopedic says, okay, let me try with an arthroscopy to wash out and clean your joint. These generally accelerate the degeneration for several reasons. And the end point is the prosthesis, or in general, major surgery.
Okay.
That, of course, is a kind of a major surgery, so with the complication and so on. But there are large group of our society that cannot have this track. And I give you some example.
Yes, please. Yeah.
So a young patient with severe problem, to say, of the knee, of the hip, cannot have a knee or a hip replacement because the duration of this prosthesis is more or less 10-15 years. So all the orthopedics are say, no, we cannot do that because you can have this operation is one shot. So they say, we cannot do so much. This group of patients, before becoming opioid addicted, as generally happens, would be better to start some kind of regenerative treatment. And this is one group, big group of patients. Another big group of patients are the elderly and frail patients that cannot tolerate major surgery. And in that case, nowadays, and this is an enormous problem, they are addicted to painkillers and opioids that generates a lot of contraindications of effects and toxicity. So these people should have some kind of other option.
For sure, yeah.
These are the main ones, only to say.
Is this the whole opioid crisis, which is getting more and more attention? Is this a common factor in the UK? Do you see very often that you get old, elderly people and young people who are severely addicted to opioids through prescription because of pain?
Extremely common.
And doctors, so you must not be the only doctor that's aware of this. What is the
well, the problem is that nowadays it's quite easy to have a patient of a certain age, 70, 75, that has some kind of comorbidities that are very common, such as obesity, blood hypertension, diabetes, degenerative osteoarthritis, that are one of the most common degenerative disease that generally they go all together. And sometimes they have even a problem with the arteries or previous stroke, or so with anticoagulant and blood thinners. So it's reality the combination of multiple drugs that determine dramatic effects. And in particular, because we are talking about that, traditional painkillers that are taken on daily basis generates a lot of toxic effects.
Yes.
And not saying about the opioids, as you can imagine.
Yeah. Do you think that it's almost an easy way, because when people are, I guess, in their 70s, elderly, it's a lot cheaper to just kind of prescribe medicine rather than going down these routes of, you know, having more advanced procedures and researching into, I guess, experimental surgeries, stem cell treatments. Is this, do you think, partly to blame, like there's a lack of funding and finances come down to it, or?
Oh, it's a combination of factors. Is a cultural problem. Is a concept that is completely wrong. That is treating symptoms and not disease.
Yes.
This is the most common misleading concept in our society. We treat symptoms, but quite rarely we treat disease. And this, of course, generates a sort of perennial dependence of these drugs, that these drugs do not treat anything. They simply treat symptoms. If you are high blood pressure, you take the pills. If you stop the pills, the blood pressure becomes high again, and so on.
It's patching it up, you know, it's like a bucket with holes and you're just putting tape over it.
Exactly. So it's not only a problem of painkillers and opioids. This problem is inside a large scale problem.
And you, as a doctor, was this something you weren't aware of until further into your career, or when do you start noticing this? And
well, you know, as a surgeon, I survive a little bit better with my activity because we sometimes solve problems.
yes.
Not only postpone, sometimes generate problems as well. But
hopefully not.
Hopefully not. But you know, no, it's joking. But anyhow, of course, when we have a patient in emergency or in elective for example, cancer surgery, of course, the so-called comorbidities that are all the disease that the patient has in unison with the age and so on. This, of course, is calculated for the risk of operation and for the outcome of the surgery as well.
Yeah. Okay. So when did you actually start getting into this? Because you started off in Rome, am I right, doing microsurgery?
Yeah, I worked 10 years in the University of Rome. And then I have different other experience here in UK, United States as well. But then to cut short, in 2013, I decided to come here because I had a good, possibility.
Yeah.
And but you know, in this kind of sector, of research, generally the research is quite spread in different groups.
Mm-hmm.
So some part of the research still is there in Rome. There is some other in other place of Italy, another sector in the United States as well, that we are in constant communication, and other things are happening here in UK. So because of course, as you can imagine, there is a big universe between a concept, an idea, laboratory, experimental models, in vivo experimental models, clinical application, clinical trials. All these things, of course, take ages before having something that that really can work.
What phase do you mainly would you get involved with yourself, as well as obviously doing conducting surgery?
In practice, two genuine original things we have done. One is, as we said before we start talking about degenerative osteoarthritis, we devise a kind of individual medication that is from the blood, that is an hyper-concentrated mixture of heat shock proteins and fraction of nucleic acids.
Heat shock proteins. So
yeah,
what I know from heat shock proteins is released when you sauna. So like from what I've read and I've listened to Dr. Rhonda Patrick. She talks a lot about heat shock proteins and about how the studies that she's conducted, when you expose yourself to high temperatures, your body releases heat shock proteins, and there are links to that with longevity, life extension, fighting even things like Alzheimer's and dementia. Is this in the same area when you talk about heat shock proteins?
Well, heat shock proteins are, as the name said, came from a cell that is stimulated with a premortal stimulus. So before gonna die, the cell produce these proteins. That is a pool of proteins from to say 2000 kilodaltons to 120 kilodaltons.
Okay.
So big and small things with the different actions that are the attempt to stabilize the membranes of the cells, to stabilize the mitochondria of the cells, to try to discharge the denaturated proteins and replace them. And most of all, this happen inside the cells. But outside the cells, where they go outside the cells in the extracellular microenvironment and in the bloodstream, they have other effects, such as stimulating the compartment of stem cells.
Okay.
So there are, these are only to say very roughly, and the activation is not only with the temperature. The high temperature has been the first thing. The heat shock proteins come out with a low, high temperature, electromagnetism, infection, stimulation, and any kind chemical, so on, stimulus that put in danger the life of the cell.
Ah, okay. Interesting.
Yeah. So they are very powerful molecules. And coming back, so we devised this kind of hyper-concentrated mixture from the patient own blood of a pool of heat shock proteins, fraction of nucleic acids, and positioning this matrix where there is the major concentration of stem cells. We have a kind of effects, clinical effects, and joint reconstruction. This brought to a clinical trial with a good number of patients that was very promising. Then, of course, as usual happen in this situation, funds and the lack of funds stop things. And even the facts, because these are medication that you have in your blood, so are very cheap in reality. And these do not attract particularly any kind of big
the investment
pharmacological group, because they cannot earn so much in there. So of course this kind of a study reached the clinical trial that was very successful, stage 1, but still we are struggling to pass to the stage 2 and for a definitive validation.
What do you do about that? I mean, surely that must happen very often.
Yeah, what I do, not so much. What I mean, I publish a lot of these things, and like all the researchers, we are very happy when we see that something really works. But I'm not, a businessman, a guy that go around able to collect funds and so on. So when you reach a point, you abandon sometimes that kind of things for other kind of research that at that moment is quite intriguing you.
That's quite sad.
Yeah, this is sad, but it's abandoned is a way to say it's always there, and there are in any case patients that are currently start to be treated in a private hospital in the center of Italy because the ethical committee gave the approval to have this treatment.
Brilliant.
And so it is restarting, not with me, of course, but with other people. And this is very promising. But then COVID stopped these things. We signed this agreement on last January, and when start, of course, the process of there are many things, bureaucratic issue
hoops to jump through.
Yeah. So when we were almost ready there, COVID stopped everything. So hopefully, in the near future.
Do you have any insight into when you might be able to? Now things are changing. Is there a positive outlook with the whole COVID situation?
But I think that in after summertime we should start.
Okay.
Of course, we should restart these things.
At the moment, are like the majority of doctors who aren't involved and surgeons who aren't involved in, I guess, the front line of COVID-19, are they being drafted to get involved? So are you getting brought in to do things with this, or are people getting sidelined? How does it work?
Well, to be honest, I like to be involved in terms of trial design and to train them how to do these things. But then I like to step back, because I always think that any kind of procedure needs to be done by others to be really successful.
Yeah, that makes sense.
Because if you are all there, there can be a bias in your research. Yes. So at a certain point, you need to pass the buck to others.
Well, that must be difficult, especially if you do that on everything, and it's your baby, you
Yeah, I know.
Yeah.
Sure.
What happens with moving forward with things like funding? Do you see any alternative option of how new innovative procedures that lose funding could then be funded in the future?
Well, funding is to me a very mysterious thing, even now, because I get used to be funded by the university, and it was a business case. You have to fill up some forms and so on. Of course, there are nowadays a startup and things that have a kind of crowdfundings and other ways to be funded.
Okay.
But I think this is for professionals. It's not for researchers. So
Okay.
it's something that is promoted by some kind of, I don't know if the word is appropriate, investor that believe on the project and want to collect funds around that.
Yeah.
And at that point, you can, go ahead with the next step.
Okay. So I see, but I think
Science is full of these things.
Yeah, that's the kind of impression I get. Every scientist I speak to in every field, unless it's a tech field that is going to generate huge amounts of revenue, every other field seems to kind of just get brushed under the rug. And
yeah, but this is quite normal. There are a lot of discovery in science that people sometimes checking literature of 50 years ago said, oh my God, they have done this. Let me retry and we'll be successful after 15 years. We have examples of that.
Yeah. I was noticing, I obviously saw that you had spoken. I didn't go there last year. My colleague went, Rich, to Radfest last year. So I saw your profile on there and noticed that, you are obviously involved in the longevity field from your surgery. What kind of, what's your outlook upon that in general, about life extension and longevity? And for anyone who's listening, I guess, who isn't aware of this, there is, quite a large movement growing about trying to extend people's healthy lives, making sure that we live longer. And if we live longer healthily rather than having a quick deterioration. That's the kind of outlook, I guess, from it.
You're right, Ash. Well, longevity is a very interesting sector. Years ago, it was called anti-aging, no?
Yes.
Anti-aging, and then modified in longevity. What I try, even if it's not my field of research, but what I found quite interesting in this sector of research is the fact that at the end of the story, besides the lifespan, is a quite genuine attempt to prevent the degenerative chronic disease that most of the time brings us to death.
Yeah, I guess that is the most common thing, right?
Yeah.
It's not just old age, it's you die of a disease associated with old age.
Yeah, exactly. So age is not considered a disease in itself.
It should be.
Exactly. It should be, even though this perspective is changing.
Yes.
But in any case, age is related with blood hypertension, diabetes, sometimes obesity, cancer, that is a chronic degenerative disease, atherosclerosis, and so on. So all diseases that sometimes have a common denominator, that is the chronic inflammation.
Yeah.
That connect all these diseases at a certain point. So
could you explain, sorry, the chronic inflammation? So because
there are a lot of study about that, and these studies are focused about what is the common factor that join the chronic disease.
Yeah.
Degenerative chronic disease. One of these factors, possibly the most important, is low-level chronic inflammation.
So is that on a cellular level?
It's at any level.
Yeah. Okay.
Chronic inflammation means that your tissue react chronically in an abnormal way to the stimulus.
Yeah. Okay.
So you have a high level of some cytokines, interleukins, prostaglandins, mediators that generate, of course, deregulation of your cells and organism homeostasis.
Yes. Okay.
And this, of course, we cannot say that this is the cause of all this disease, but is a common factor that we found in all these diseases. So means that possibly is a biological station at a certain point that interconnect this situation.
And that's including, I mean, I've read cancer, for example, is
cancer.
It's an inflammatory disease essentially.
Yeah, with any of them are very particular and peculiar, no, specification. But there are even common denominators.
So, as we approach, I guess, aging, as we get older, our cell reproduction, our rate of healing slows down, and then is that we develop inflammation? Do you think due to our cell breakdown, and then these diseases come, or?
Well, longevity should, in some way, tackle this problem at different level. There is, of course, a genetic level, epigenetic, that is quite important.
Yeah.
There is the fact that what we considered before, such as two different words, the word of genome and the word of your phenotypical expression, in reality are very dynamic and interconnected. Your gene change more rapidly than we thought, and there are many factors that can modify their expression quite rapidly and easily.
Is this due to outside stimulus, do you think? So like diet and stuff changes?
Yeah, exactly. Lifestyle, the diet, sleeping. Sleeping is so important, how you sleep, and that is only that is a word to talk for hours. So physical activity, your level of stress, your psychological and behavioral features that can generate some kind of stress, anxiety, and so on, that affects a lot your so many factors that brings you to a certain life, and the expectation of your life, besides of course car accidents or something like that, but you can modify a lot.
Yes.
In natural terms, you can expand a lot if you consider and put in there in your behavior, day behavior.
So your lifestyle choices.
Different lifestyle choices. This is very important.
But what do you think, if somebody has certain genetics which would make them predisposed to developing certain diseases as they got older, is this something that is your lifestyle choices could actually mitigate and stop these genes being activated? So do you think, like Alzheimer's, for example, dementia is something that can be genetic? Do you think that if whatever you do, if you've got the gene for it, you're more likely you are going to get it? Or do you think you could do something and change certain aspects of your life to stop that?
Well, neurodegenerative disease they are a quite new field in medical knowledge and in research. They were not there up until few decades ago.
Really?
Yeah. No,
Okay.
Alzheimer and these things, of course, were studied, but not like this rate that we have at the moment. Possibly because, of course, the age, the lifespan was shorter. This can be a cause. But, you know, this kind of neurodegeneration as well, the genetic are very important. But even when we talk about genetic, we have to consider even the amount of problem that your genes can bring to you. So I want to say, if you develop, to be practical, if you develop an Alzheimer at 20 years old, of course, this is a complete genetic disease.
Yes.
But if you have start having this problem at 60 years old, means that your genes are prone to do that. But you can interfere or in some way curb this situation, modifying factors around it.
Okay. I guess so, because the genes are generally they're activated by outside factors. So as long as you don't trigger or you don't do the things that trigger those things, then you could essentially stop that from being active. And
well, of course, gene is a kind of expression on that tissue that has an impact of the expression depending by the epigenetics. So what I say, if of course you have a group of genes that are completely compromised, there is no epigenetic that can work. But even if they are working in a low rate, so if you modify the epigenetic, that can happen with some kind of different behavior and lifestyle, this is what the research tell us. We can expand, we can move forward the time of expiration of their activity.
And do you think that, kind of looping back a bit to what you work with the stem cells, is that applicable for treating a lot of age-related diseases? So can you treat, it's not just tissue-related diseases, you can treat other things. So for example, do you think it will come out that stem cells can help with Alzheimer's and can help with maybe cardiovascular diseases, that kind of thing? Yeah,
this is what the research is telling us. There are a lot of experimental model and clinical application on that are working very well. Now we have a little bit to, in my opinion, to highlight how these stem cells really work, because in the common idea is that you take some stem cells somewhere, you inject these stem cells, they go there and sort everything and fix everything, such as a magic potion. So this doesn't happen in this way. So what's happened? First thing, depending by the stem cells that you're gonna use. The most used are the mesenchymal stem cells. You can use this stem or the hematopoietic one as well. So you can use these stem cells from the patient or from others, because one important thing is to know that stem cells doesn't, in particular mesenchymal ones, doesn't bring a problem of rejection.
So there's no interference and no genetic issues
No. That's why you can use the cord blood stem cells of any kind of storage and inject to others, because you do not have any reaction about that.
And you can grow, right? You would take the mesenchymal stem cells and you could grow those en masse. So you could take, could I take stem cells from myself and then grow those to then re-inject to myself?
This, what you are saying happen to regrow a tissue and so on is very well reported and documented in vitro experiments.
Okay.
But in vivo seems that they work in a different way. So when you, for example, you take the blood cord stem cells because you want to fix a problem in your heart.
Yeah.
Okay. After a myocardial infarction, to say you want to improve the scar of the myocardial infarction. Mm-hmm. So you put these stem cells in the bloodstream of the patient. They reach the point in a certain amount of cells, other are dispersed in your body, and what it seems that they do not work going there in the site and becoming the cells with the process of proliferation of differentiation in the cells that you want to have.
Yeah.
But they simply have three different main functions. One is anti-inflammatory, one is immunomodulation, and the third one is a trophic function. So they're gonna stimulate the local progenitor cells to replace the injured tissue.
Okay.
So they work such as a mobile chemistry, going in some place and activate in a proper way that tissue.
And they essentially work out what to do correctly without you aren't you aren't pre-programming these, or these are just sent in and they see the problem and then they work it out themselves. The stem cells can do that.
Yeah, can do that because in some way there is a complicated system of molecular feedback and counter feedback that brings them to work in this way.
Okay. Wow, that's absolutely fascinating. Would you recommend stem cell treatment as a preventative treatment eventually, or?
No, at the moment I don't find stem cells as a prevention treatment for anything.
Mm-hmm.
But in my opinion, in the future, will be recommended as a not ending point, but a starting point of treatment, because you can reverse the problem at the beginning. And this is an enormous, advancement.
That is medicine. Huge. Yeah, absolutely.
Yeah.
I've heard that in a lot of countries, it's quite difficult to use stem cells. I mean, in the USA, there's certain things that are stopping people from using stem cells. So they travel down to places like Panama for treatment and things like that.
Oh, yeah. Yeah, this is, of course, this kind of regulatory attitude to not be open to the future
Yeah.
generate a lot of distortion.
It's the
So
fear of the
people,
unknown, right?
yeah, if you see the border between California and Mexico,
Hmm.
is full of hospitals and research centers. Some are pretty good,
Wow.
others no. You know, there is a kind of a procession of people from the United States going there to have this kind of treatment. In Bahamas as well,
Whoa.
as you said, in Panama, but there are so many places. Uh, South Korea,
Okay, so
uh,
it is starting to become
yeah,
that more places.
Cyprus.
Really? Okay, that's
Uh,
good because yeah, I thought there was a big opposition. I guess like people, being scared of it and not really understanding it. So I've seen quite a few politicized posts of people who are, saying it's evil and that it's against, it's against nature and it's against God and that we should not be messing with this. But I mean, of course, medicine is messing with in
yeah,
general. If we treat any disease, surely that is.
yeah. Well, you know, there were in the past some ethical problem that has been completely overcome about the use of embryonic stem cells.
Okay.
But embryonic stem cells, there is no reason anymore to be used because we are now able to reverse an adult differentiated cell of your body
Yep.
to an embryonic one.
So you can take
So,
one of my cells.
yeah, one of your cells of the skin can be bring back to an embryonic one.
Holy
Uh,
crap.
this is this is no, they won a Nobel Prize in 2006 or 8, I don't remember.
Yeah.
These Japanese researchers, and they discovered a way to um, bring back an adult differentiated cell to an embryonic one, a so-called IPMN cell,
Okay.
and so the problem of the embryonic one to take these cells to an embryo and transplant to other is completely overcome at the moment.
That's fantastic.
Yeah.
Great. I've got a couple of questions actually from people listening that I just like to read out. The first one, it says longevity. This would clearly prevent medical costs, in brackets, healthy old people. However, wouldn't this impact on other resources with having people living longer in general? And also they said, would pharmaceutical companies may not appreciate longer living people too?
More than the pharmaceutical company, I can say governments in general that have to pay pension and have to pay
True.
our health services. Of course, it's not to be cynical, but it's quite normal. As much you live, as much I have to pay.
Yep.
So I think that this needs to be overcome with a new ethical model of life and modify our current welfare parameters. Otherwise, with this kind of parameters, we cannot go ahead more than this.
Yes. Yeah, definitely. The other question that has this is definitely a question of ethics. Should population size control be considered if we are to increase lifespan?
Oh yeah, I think so. I don't know. I am not expert on that, but I imagine that because because our planet has certain resources, and
Yes.
if I am not wrong, we are already exploiting this planet more than the resources that it generates in a year. So we are already over the top.
Yeah.
Of course, that's why I say, if we consider the problem, if we consider the longevity with the current parameters, cannot be sustainable in the longer term.
Okay.
Needs another model of a society, other political models,
Yeah.
to be sustained, of course.
And having some form of population control poses quite a lot of ethical questions, and because you have to kind of enforce consent to have that population control in place. So
it's quite tricky, a tricky way to consider the future society, this one, because in any case this modification will happen.
Yes. Yeah.
Everybody knows that you cannot stop any kind of progress in humankind,
That's actually been brought up many times now in this podcast. We've had a virtual reality designer, we've had a scientist who works in holotech, we've had a film director who was also involved in post-humanism and future humanism, and they all have said the same thing, that you cannot stop. Once you open whatever the Pandora's box of science and development, humans will just keep going. We've first had microphones, and now we've got these things that are attached to us. Essentially,
what you can do, you can curb, you can sometimes mislead, you can take time for things, but at the end of the story, for sure, you cannot modify the course of the events.
Yeah.
Definitely.
So I've got two more questions, actually, if that's okay. Which is, should we be worried about the quality of stem cell production? They've the person who asked doesn't know how well regulated it is in the UK or in USA, but is this something that could you imagine there would be black markets of stem cell production en masse, or is there any concerns?
Well, there are some potential distortion in this system. The one that I see as the most possible is the market of the fake stem cells.
Fake stem cells.
Yeah, they say, I inject you stem cells, and I don't know what they are going to inject in you.
Saline solution.
Because the important thing is to know, of course, for example, I'm talking about the cord blood stem cells, because there are national storages for that. So and there is a proper register, so where they come from. I am talking about allogenic stem cells. That means from other people. If they are have been used, your stem cells, it's important to know what is the process. How do they collect them, and
storage as well, I guess.
Storage if needed. Sometimes there are now many procedures that are almost in real time.
Wow.
So the procedure, the methods is quite important. Generally, these procedures are for clinical practice are simpler that you can imagine. Okay. And with kind of enzymes and centrifuge, you can obtain quite a good product. DSF, for example, that are adipose stem cells from the patient, is a process that is very safe and is very widespread. And it is allowed to do that because you can move tissue of your body in another place. It is allowed to do that. So there are some things that is possible to do, and others that are more difficult, such as I said before, moving stem cells from for a donor to a receiver. At that point, it's not only important the quality of the product, but even the amount of stem cells that you're gonna to transplant. There are still not standard about that. So there has been a study when for some disease has been transplanted 10 millions, 50 millions, 500 millions cells, because the good side of the story is that you do not have particular side effects or problem. But we still don't know because there is no standardization on that.
Okay, I see. So in the future, you don't really know.
This depending by the experience of the research center and sharing information as well.
Cool. I've got one more question that I'd like to answer, and then I guess we should probably stop wrapping up. It's been just over an hour, which is great. This is actually a personal question. They have asked, they are intrigued. What do you do to relax and rest your brain?
Oh, this is interesting. I like, of course, I'm quite a social animal. So I like to have sport. I every day try to be active. I go to work on foot every day, never take the car.
Yeah, great.
I like to stay with friends. A good glass of red wine in the evening can be nice.
And that's good for your longevity too, right?
I don't know. You should, for longevity, if you intend for the resveratrol, that is an antioxidant contained in there, you should drink 5 liters of wine. Is too much, to be honest.
Okay.
If you want to have an anti-aging effect, is too much.
Yeah.
No, 1 glass is all right. To be honest, I enjoy a lot to study other experience and to write about this field of research that has always intrigued me. So to me, it's quite relaxing in reality.
Okay.
To get into these kind of things. I can feel more stressed in my normal clinical activity.
So doing surgery.
To deal with the cancer patient, not for the surgery itself, but for the, that bad news that you generally can bring to the patient. This is awful, and it brings with you generally at home.
I can imagine.
It's difficult to unwind even after several years of professional activity. Is always something that is not good.
Yeah, I can only imagine. Yeah, it's a big burden for sure. So thanks. So I think we should we'll wrap this up in a minute. Is there anything you'd like to say before we go? And would you like to do you have a website or anywhere that anyone can check out your stuff?
Well, at the moment, no, I don't have a website. Possibly in the future, because we are thinking something about with even these longevity rad people, in case kind of a web window for regenerative treatments, tissue regeneration, and
Brilliant.
so on. So I don't have at the moment, but I should do that.
Yeah. Well, you've got the page on Radfest right at the moment, which is your bio.
I have some page sparse somewhere, I don't know. But anyhow, this is a question of communication that is important, of course. Now, what I want to say is that one thing, in my opinion, that prolong our longevity, but most of all our quality of life, is to try to be interested in something.
Okay.
Because to be involved in something that you are passionate to, that you are intrigued to, independently what is the sector, in my opinion, helps a lot to maintain your brain active, your perspective in the future, prevent some kind of depression that is quite seems normal in this society. And so this is an important recommendation, and to try to even preserve your mental and body performance in a right way, coherent with your age.
So even as you get older, you still need to keep staying fit. Cool.
Our body is not has not been made to be stand still in front of a computer, eating junk food and drinking sugary,
cola and pop. Yeah, you're right. Well, thank you so much for your time.
Thank you.
I had a lot of fun, and I look forward to speaking to you again. And I'm sure I'll send you the links to this afterwards, and I'll put on the link to your Radfest page. And when you do get a website, send it to me, and I'll make sure it gets put on our website as well.
Yeah, but we can project something together, Ash.
That sounds perfect. Thank you.
Yeah, I think so. There is something in my mind that I want to share you in another conversation.
Brilliant. Okay, great. Okay, thank you. I'll
thank you very much.
Cheers.
Thank you. Cheers. Bye.
Wow, that was another very insightful conversation. So in the end, we know that happiness, we heard it from a master surgeon and doctor himself, that happiness is the key to longevity. So focus on something, stay positive, get a hobby that you love and enjoy, whether that's a sport or music or art, and focus on that. Keep your brain active. Don't stay sedentary, and avoid sugar, which is what I always say. Anyone who knows me knows that. Thank you so much for tuning in. This is Shifty Perspective. If you enjoyed this and you're listening on YouTube, please hit the subscribe button below. And if you're watching this on Facebook and you haven't subscribed to our YouTube channel, please subscribe to the YouTube channel. We can only grow, and I'm trying every week to get new exciting guests. So hopefully we will continue doing this. Speak to you next week. Thank you.